One more quick question. Will private doctors and dentists be able to see patients outside of the government health system?
That's a great question. Maybe we could all give a crack at that one. The answer may very well be no. Okay, I know many of my own clients, conservative businessmen, who are fed up with the high cost and have said, I can't take it anymore. I'm willing to take the government option because I'll get mine. Or we'll have a management program. There was talk about a hospital shift during the Hillary Clinton era. There was lots of talk about having some sort of a separate plan. But recently, of course, we've seen House Bill 3200 come out. And on page 16 in section 102, which some of you might have read the Investor's Business Daily article from the other day, it specifically says, you can keep your insurance, but it says if you leave your employment or if you become self-employed, you must enroll in the government option, period. That there is no private insurance after that. So now the question is, well, are you going to have a doctor there to treat you? The president's gone around this country talking about the advantages of centers like the Mayo Clinic. And you may have heard that the Mayo Clinic recently signed a letter along with several other very well-known clinics in this country saying, if you institute this price structure and force us to accept the Medicare cost shift, basically Medicare plus 5 or 10% for our entire book of business, we're out of business. We're gone. So one, it may be illegal. And that sounds almost surreal to say until we read that bill. And people are very concerned about that. It may be illegal. And secondly, if you need to fund it with an insurance program, there may not be an insurance program for that. And lastly, you may not have a provider left to see.
You know, and the reason why Mayo Clinic says that is because in the government's own program, it pays the providers less than the true costs that it takes to provide the care for those patients. So the Mayo and the Cleveland Clinic and Northwestern here and Rush Presbyterian and all the local hospitals are in exactly the same situation. And that is, if you mandate government payments across the board, then they're gone because they won't be able to cost shift anymore. So the hospitals will close and doctors will leave, be out of business.
Here's a price example, okay? To the cost of malpractice insurance for an obstetrician is approximately $1,000 per delivery based on the average number of deliveries and the average number of costs and whatnot. Okay? If you're an obstetrician that happens to deliver a baby in a public clinic and you're relying on Medicaid for reimbursement, Medicaid in the state of Illinois is reimbursing slightly over $900. That clearly is not paying the cost of just the malpractice insurance, let alone all the other attendant costs that the physician has to incur. Imagine that now, extrapolate that across the entire system.
You want to know the real kicker in that? Then they pay 120 to 180 days late.
Yeah.
Yeah, tell that to ComEd when you need to pay your electric bill, right? Bill?